Welcome to Great Smile Dental. I'm Dr. Shambach. This is my colleague, Dr. Schwartz. And today we're going to be discussing our permanent tooth solution. Oftentimes you'll hear this as teeth in a day, teeth in an hour, teeth in 24 hours. It's a lot of different things going on with the terminology there, but it's all the same. Dr. Schwartz, could you go into that?
Essentially, you come into our office. That day, we remove the teeth that are infected.
Right. It may be both arches, it may be the top arch.
Whatever we need to treat, one or both arches, we place implants. The implants are standard diameter implants, and they are fixated. There is a transition element that allows us to essentially meld it to a fixed prosthesis. And essentially, within 24 hours or within a short period of time, we will have a final prosthesis that you'll be walking out with. Now, there are two stages to this as well. The prosthesis you walk out with will not necessarily be the prosthesis that you have forever. We like to give several weeks to months in some cases to allow everything to heal, but you have your teeth the whole time.
Yeah, and that's the quality approach. You don't just have one prosthesis right after surgery, you have a final, and that's the quality way to approach these cases.
Tissue changes over time. The idea is you come in, we give you something that is fixed, and you walk out. But that's not the end, because it never is. We require maintenance, we want you to be healthy, and we want your teeth to last a long time.
Clinically, what I've seen with this procedure is patients are just elated with not having to remove their teeth. It's a game changer, isn't it?
It is. I mean, not just from the cosmetic standpoint, but also just from a function, from having missing teeth or sore teeth. Now you have something where you have something that's fixed.
Right. What makes our office different, I believe, is that your experience placing the implant and having our own lab on site, being able to get the prosthesis out. Before I had my own lab, we would ship it several hundred miles away, wait for it to come back. It became a big production. If you do a lot of these procedures, you really need to have your own lab on site. Do you agree?
Absolutely. Well, it streamlines the process. It's not a simple procedure.
No.
It's not something you do over a weekend course.
Right.
Okay? You know, we've spent many years refining this, and we still will continue to refine it. There are always improvements to be made, but everything is on site, and therefore we can interact with each other. You and I have different fields of expertise, and they're critical to work in concert.
Right, right. But the patients walk out, and post-operatively, almost no post-operative pain.
It's remarkable.
Yeah, it really is.
It's not a painless situation, but it is very tolerable.
Right.
And considered to what was there before, oftentimes with infection, we are now in a situation where we have a restoration that is aesthetic, is functional.
It's because that prosthesis is now locked on the implants and not rubbing the tissue that has now had surgery on it.
You used to your teeth your whole life. To go to a denture is a little bit much to ask sometimes to adapt.
Right.
This is more like your teeth. It never will be completely like your natural teeth, but it approximates it to a point where aesthetically you can smile, you can function, you don't take them out at night.
Cosmetics are great, the function's great. It's what patients want.
That's what I would want if I were in that situation.
Right.
It's just wonderful.
No one wants to remove their teeth at night.
Absolutely.
I've found very few to do.
Correct.
And we use state-of-the-art materials and just really great results. And of course, your surgical technique is flawless.